here in the Broome hyperbaric chamber. I look back on my second year Kimberley immersion program with really fond memories, the opportunity to meet some people that worked on cattle stations and get to know a little bit more about their life. And this was where the seed was planted that maybe I should have a year off uni and become a ringer. I got connected with Peter and Cheryl Camp, who are the owners of Calieta Station, which is a station, it's about 4 hours from Broome. It's between Derby and Fitzroy, it's just south of the highway and backs onto the St George Ranges. During my time working on the station, I learned things I'd never imagined. I went to the station not knowing how to ride a horse. I learned how to ride a horse and ended up riding in the Derby picnic races. I did come dead last though. I learned how to fence, I learned how to service vehicles, I learned how to service generators, I learned how to process cattle. I vaccinated 10,000 cows in my time on the cattle station. What I didn't anticipate was the skills that I would learn interpersonally about working within a team, working towards a common goal, digging in when the going gets tough. The people that I worked with, the quality of those people was second to none. They were humble, they're wonderful people. Over the past 2 years, I worked in Broome Regional Hospital. Working regionally has allowed me to develop a really valuable insight into the impacts of the social determinants of health, simple things like whether or not a patient has a car, whether or not they have a mobile phone, and therefore creating practical solutions that ensure that patients are able to receive the best quality care.
The finalists for the Metropolitan-based Bush Champion Award are
Professor Donna Mack. Recognising the challenges of recruiting and retaining medical practitioners to rural and remote areas, she worked to establish rural health placement programs in the Wheatbelt and West Kimberley. These programs provide medical students with academic learning and immersion experiences in rural life, aimed at encouraging them to consider rural medical careers and providing metropolitan doctors with a deeper understanding of rural life to better provide patient-centred care.
The Kimberley program was a wonderful experience for our students because it enables students to see strong Aboriginal people, strong Aboriginal culture and, self-determination in rural Australia.
I was with the Bintanganga Rangers. They looked after land, taught us about hunting, fire starting, and pretty much how this all related to how they connected to country. So in protecting that country, they were able to still heal on country, and which we knew coming in was really important to Aboriginal people, but actually being out there really truly appreciated how healing on country was to Aboriginal people.
I absolutely love this program, bringing students in their second year out into the community, to be immersed in the community, to be a part of it is not something that you can teach in a classroom. So to give them a taste of some of the most beautiful, unique things about working in a community is essential to their training, and I would love to see this program being embedded strategically forever.
I was fortunate enough to be placed in the remote Aboriginal community of Wangkatjungka, working in the local school for the week.
Just seeing the impact that teachers in those communities were able to have on the children out there was something that was really inspirational to me.
And something that I recognise after doing this placement in the Kimberley, if I want to make lasting impact in these communities, I myself need to be integrated into the community.
The Derby trip is special for me because it's probably the reason I'm doing medicine at all. I was a registered nurse in Derby when a group of second year Notre Dame medical students came into my emergency department. Speaking to one of the students, she said that she'd been a registered nurse. She'd then gone on to study medicine, and that's really where the seed was sown for me, and I had a homecoming, I guess, when I came to Derby as a second year medical student, and have since come back to Broome. I went to Broome as a fourth year medical student, then stayed on for my intern year, my RMO year. I'm now a GP registrar, and I am planning to stay on in Broome in the Kimberley. I got to come back to Derby as a resident medical officer last term and spent 10 weeks here back in Derby. And it was amazing to come home and see friends, and everyone was incredibly proud of my journey. And I wanted to stay up here and give back to the community that supported me and where it all began.
The program's invaluable in bringing people who don't live in remote areas to places like Fitzroy Crossing where they learn from the local people. It's awkward for people sometimes to move into a remote location when they've never experienced that before, and it's a really good way for them to get a feel whether it's for them, and it just gives them that little taste.
3 years ago I came up here and spent some time on a cattle station, and as a city boy I never thought I could live or stay rurally. 3 years later, I've spent all that time in the Kimberley, done my final 2 years of medicine, and now I'm an intern at Broome Hospital. I've applied for GP training and I've been successful in getting on the program, so I start training in 2025. And, developed a lot of passions along the way, like fishing and camping and, exploring the amazing Kimberley, doing things like the Gib Challenge and the Lake Argyle Swim. And I've really made myself home in the Kimberley. I've also developed a passion of barbering, and I wish to sort of use that with my GP qualifications in the future and work towards men's mental health and rural mental health and become a GP barber. So yeah, I'm very grateful that Notre Dame does this and hope Notre Dame continues to do this program. The insights that I gained and the connections that I made have been invaluable to my career in the Kimberley and really helped me solidify a life and plan future in the Kimberley and working rural. So I don't see myself leaving anytime soon.
We were placed with the teachers at the school there in Wonkajonka. So there were 2 female teachers. We got to go into the classrooms with them every day and see the sort of things that they did out in the community and see some of the programs that they had put in place to help with the children there as well in terms of health and also education. I really came to appreciate the disparity in health. It really made me want to come back and work in the community to help build the health of our community. I felt very much a part of that community for that week. So up here in Broome, I have 3 jobs. So I work 2 days a week at the hospital doing obstetrics. I work 2 days a week at the Aboriginal Health Service here in town looking after our pregnant women. And I work 1 day a week for the Rural Clinical School supervising the students. But I love the combination of my jobs because it just allows me so much continuity, one with my patients. I get to see them in the clinic in the AMS, and then if they need an induction or a cesarean, we try and plan it for the days when I'm at the hospital so that we can have continuity with some of our more vulnerable patients. So I think for me, having grown up most of my life in the city, all our placements at Notre Dame, from our Wheatbelt trip to the Kimberley trip to my year in RCS, really helped open my eyes to what it'd be like to be a rural doctor. And I think without those experiences, I wouldn't be here today.